minutes late, just finished my OPD, that's why. So you can ask me the questions which were left behind last time, or we can start with new. Yeah, so thank you for being online with good numbers so that it's very easy for me to talk to you. Now, lot of patients comes to you, and one symptom which is very very important that you have to take, that is called as non-verbal communication, and that is what the patient does involuntary, without his notice, without his voluntary power. For example, sleep. Now ask the patient, how does he sleep? In what position does he sleep? For example, a patient comes and tells you that I always sleep on the abdomen. I always sleep on the abdomen. Now what happens? This is a very classical symptom. Of course, the first remedy that comes to everybody's mind is medorenum. It is there. But there are some remedies which are very very rare and that you have to remember. For example, I had a case where the patient had a classical habit of sleeping on the abdomen. No doubt, medorenum you can think about, but there are other remedies. For example, you can think about a simple remedy called as pulsatilla, sepia, carcinosin. These are remedies which basically have symptoms. They always sleep on abdomen. But there are few remedies which are very very important who sleep on the abdomen, and that remedy you should always remember. First remedy which has given me good results when these polycrest when I have used and they have failed, that remedy is belly spur. Now belly spur has a symptom that patient sleeps on the abdomen first, and second symptom of belly spur, whenever the patient is sad. There was a case where the patient said that I have a lot of depression, lot of sadness, but Dr. Saab, whenever there is a thunderstorm, whenever there is a lightning, whenever there is thunder, I feel very happy. And now sadness better by thunderstorm, or sadness is amelioration in thunderstorm. Why I took up the case? Because today is rainy season and there is a thunderstorm. I prescribed the patient carcinosin, that failed, and then I prescribed the patient belly spur and I cured that patient. One more symptom of belly spur that you must remember is there is lot of confusion about the surrounding. Oh, where is my wall? Where is the cabinet? This is a TV. There is a lot of confusion around of the surrounding, and that is a very very important symptom of belly spur. A belly spur patient also has the same symptom, that is sleeps on the abdomen. I hope you understood. Welcome Dr. Vishaka. Good afternoon Dr. Rasik. Hello. So did you understand this? Sleeps on the abdomen. We have belly spur, we have carcinosin, we have medorenum, we have pulsatilla, and these are very very important indications of non-verbal communication in patient. Hello Dr. Babel. So I hope you understood something about belly spur. Belly spur is a very interesting remedy. Don't always think about railway spine and gardener's remedy. That is there, but do sometime think about this also. Okay. Now let us go forward. Medorenum also has this, Peracobodium has this, belladonna, belly spur, colocin, pulsatilla. All of them sleep on the abdomen. There will be very interesting cases, when the patient comes and tells you, sir, my husband sleeps, exactly on the back. The way he sleeps, the way he gets up. So much, so classical symptom, sleeping on the back. If this symptom is there in the patient, do think about bryonia, nux vomica, sulfur, rustox. You must have prescribed rustox for so many complaints, pain in the knee, pain in the knee, pain in the knee, pain in the joints, so much misused remedy, rustox. You must have never thought about this symptom. Rustox patient always sleeps on the back. A very very important symptom of rustox. Yeah, Disha, good afternoon. Even if you have seen Mercor, not Mercsol, Mercor also has a remedy which sleeps on the back. Bryonia always sleeps on the back. Pulsatilla also sleeps on the back, also sleeps on the abdomen. Nux sleeps on the back. Sulfur sleeps on the back. Sometimes what happens, you're not able to differentiate Bryonia, Nux, Merc or Rustox in mind. Sometimes it is very difficult to interpret mind symptoms, because there are different rubrics, have different meanings according to the which theory you are following, which doctor you are following. So these symptoms, non-verbal communication, is very handy in prescription. I hope you understand this, everybody. I hope you are understanding it, everyone. This sleeps on the back, sleeps on the abdomen, sleeps on the side. Very, very important symptoms of non-verbal communication. This is how the body wants to talk to you. So understand the body, why it wants to talk in this way. Before, if you understand, just give me some thumbs up so I know that you understand. Practice में सिर्फ कैंट रेपिटरी और डिपेंडेंट होके प्रैक्टिस कर सकते हैं क्या? So Dr. Rasik wants to ask that only using Kent repertory can we practice? My answer would be yes, you can practice, but once you start using Kent's repertory, automatically you will want to study other repertories because you want to increase your understanding about repertory. For example, if you see Kent repertory has 100 pages for mind rubrics, complete repertory has 1000 pages for mind rubrics. So as you mature in life, as you mature in your practice, automatically you will start using bigger repertories. To start with, I also started with Kent repertory and I had a very good practice then also and now also. Always keep upgrading yourself, always study repertory, always study Hahnemann's Mathematica, Hahnemann's Organon. You always have something new to learn if you read it every day. Simple. If you read Allen's keynote also every day, you will get to know a lot of things in Allen's keynote also. Whatever doctors who are working with me, I start with Allen's keynote, then go to other Mathematica. Okay? Yes, Dr. Asik, thank you. So let us go forward. Okay, so my assistant doctors are online. So this is sleeping on the back. Now, there was one question also that sometimes, the patient comes and tells you, Dr. Sahab, my child, you cannot tell how does he sleep. Sometimes he is here, sometimes he is there, he is all over the room. Sometimes he is on the abdomen, sometimes he is on the side, sometimes he is like this, sometimes he is like that. There is one rubric for this also, my dear friends. Sleep changes position frequently. That means restless sleep. And whenever the word restless comes, the first remedy is arsenic. If you go in the repertory, the same word comes to you, changes position frequently. The first remedy is arsenic album. Now, if you feel that you are caged, you want to come out of the cage, and that's why you are restless, changes frequent position of sleep, the remedy is Cactus grandiflorus, and that is there in the repertory. My dear friends, you must have used this remedy so frequently. Fever with chill, chikungunya, swine flu, Eupytorium perfolatum. You will be surprised, Eupytorium perfolatum has the rubric changes position of sleep frequently. You must have used Hipparsulf so frequently in your practice. It is there in Hipparsulf, changes position frequently in sleep. See, there are so common remedies. Sometimes you are not able to differentiate the cough of Hipparsulf or Kalicarb or phosphorus. Use this non-verbal communication and you will see, you will definitely be able to differentiate remedies. I hope you understand, everybody. Just give me some thumbs up so I know that you are understanding it. I'll take one question. Sir, मेरी 2.5 वर्ष की बेटी है, underweight, homoeopathy. So Dr. Parvez says that he has a daughter of 2.5 years, underweight, remedy. So if the child is active, a beautiful soric child, no need for medicine. If you feel that the child is dull, not able to perform, not able to study, not doing daily activities properly, then you can think of some remedies. Just think of some remedies, add some rubrics, add some thermals, and you will get the remedy. Okay? Calcarea phos, lecithin, Avena sativa, alpha-alpha, thyroidinum. Just check on this remedy. compare with some symptoms, and then you can get the remedy. Okay. Cracks and burnings and itching sensation in my lower lip, and it becomes black spot also, sir. Very, very nice, and thank you, Dr. Disha, Sahil. Good afternoon. Okay. So a question is that lips. Now see, if you see this type of complaint, lower lip and it becomes black. Now whenever there's a problem here and the patient itches, and the lips become black. Now this is a beauty area. The face has to be very nice. So you can write down some first remedy. Whenever the lips become black because of itching, think about arsenic, think about Mercsol, Mercor, Lacasis, and phosphorus, which I have used in my practice. Okay. Good afternoon, Dr. Sahil, Dr. Ram Prasad. I hope you understood some. Dr. Dura, hello, welcome. So this is something about licks. Now, whenever you are writing symptoms or asking some symptoms or asking, some remedies, make sure that you ask at least some defining feature of that personality, of that case. So it becomes easy for me to understand and get the remedy. For example, if I want to differentiate arsenic from discoloration, arsenic has discoloration black in spots. That is arsenic. Okay. So this is how you differentiate your remedies. Okay. Now, yeah, thank you for beautiful hearts. It is very interesting. Because there are so many doctors online. So I am happy that to share my knowledge. This is all what I have understood in my 30 years of practice. So every time some doctor comes and tells me, sir, please start webinar and cases. I always tell you, yes, I start, but then I forget because of the busy practice what I have. I have a lot of assistant doctors, so I have to teach them daily. So whatever time I get for free time in practice, I start teaching them. I hope one of the assistant doctor tries to make a group, and then we can have a Zoom session for everyone. So let us go forward. If there are no questions, I'll just go. I'll just have an extension of lip question. There are a lot of cases who comes to you in winters that there's a lot of chapped lips, cracks in the lips, exfoliation in the lips, burning in the lips, redness on the lips. That means the chapped lips. Of course, whenever there is chapped lip, the first remedy is sulfur. Everybody knows it. But then I'll tell you some remedies which I use infrequently. Of course, they are not rare remedies, but infrequently used remedies which has given me very good results. The first remedy I would suggest is Corallium rubrum. Chapped lips, my dear friends, Corallium rubrum, whenever I have used, I have not failed. Do study Corallium rubrum. Apart from the cough remedies, Corallium is a very important remedy for chapped lips. Second remedy you should remember for chapped lips is Calcarea carb. And third remedy for chapped lips you must remember is, of course, Natramur, but I would suggest Aurum triphyllum. Just differentiate between chapped lips, upper lip and the lower lip. For upper lip, you must think about Natramur causticum and Taraxicum. For lower lip, you must think about Pulsatilla, Phosphorus and China. Generalized, if there are corners are chapped, it feels very dirty, and the patient comes with the corners are chapped, it feels very dirty. The remedy is Veratrum alb. Just by seeing the patient, you can prescribe. What I am telling you, non-verbal communication. You have taken the whole case, you cannot differentiate between Veratrum alb and sulfur and Lycopodium and arsenic. Just look at the case. Corners of the mouth are chapped. Corners of the lips are chapped. Veratrum alb. Chapped on the lower lip, Natramur. Chapped on the upper lip, Pulsatilla. Sorry, lower lip is Pulsatilla, upper lip is Natramur. So this is how you differentiate when you understand non-verbal communication of remedies. Okay. Video on channel show cure of fatty liver. Yeah, Disha. This. First of all, I would like to thank my assistant doctors who always wanted my results to be shown to the public. I have cupboards and cupboards of before and after reports which I used in my practice so that I can refer to that results. But one of doctors joined me lately, so she said, sir, I want to print this, and she has remedy. whenever I speak about a remedy, it should not be so easy. It has taken a lot of effort from my case taking and all. But I would tell you one thing. In cases of fatty liver, I have got fantastic results. Most of the cases I have cured. The first thing in fatty liver, you must ask, what are the local symptoms? Now, what do you mean by local symptoms? Every time we go, and there are some doctors, assistant doctors, who basically have no understanding of the rubrics of mind. So it becomes very difficult for them to understand mind. So I tell them, just make sure that your case taking, if you don't get the mind, at least physical symptom you have to get. So local symptoms are important. For example, there is a case where the patient has drunkard, and there's a problem in the liver, indigestion, irritation, jaundice skin, loss of appetite. Immediately you go to the case taking, liver of drunkard having a problem in the liver, fluoric acid, nux vomica, sulfur. These are the remedies. So local symptoms are also very important for prescribing in case taking. For example, I had a very interesting case of fatty liver, and I prescribed. Of course, I failed with lycopodium, I failed with China. I prescribed in the third time zincum metallicum. That cured the case. Depending on the local symptoms of the liver. For example, there are patient who comes to me that because of liver complaint, the abdomen is very distended like a football. The patient came to me, and the patient was very effeminate personality. I prescribed, Cilicia. So my assistant went down, sir, effeminate, I could not understand. I said, check the liver complaints. In Cilicia, distension in the liver region is there. So whenever the mind is there, the local symptom, the body would be there. So always tell them, if you cannot get the mind symptom, the local symptom, 3 marking, defining symptom of the local part is very important for prescription. I hope you got some idea, Dr. Disha, about this. Any for sagging face, if it is sagging because of, if it is sagging at a young age, we have a lot of remedies, Abrotenum, iodum, sanicula, wrinkled face, older than the age, then there are a lot of remedies also, Sir, any medicine for sagging face, skin volume less, creating wrinkles. Okay, Anushka, I hope you understood that. External, see, we have, if you understand, sagging face, one, we have to I told that is there. Second, also sometimes there is a lot of wrinkling on the face. So wrinkling on the face is a very, again, big symptom. You can say wrinkling forehead. You can say lycopodium, sulfur, sepia, stramonium. In headache, in general, vertical lines, horizontal lines. So wrinkled face, the patient appears older than the age. Calcareca, lycopodium, sanicula, iodum, sepia, argentum nitricum. These are the remedies you must think about, and but understand, why is the patient looking old? There has to be some primary disease which the patient is suffering from, and that is shown on the face of the patient. That is very important for us, my dear friend, to understand why is the external body showing symptom, because there is internal turmoil in the economy. That you have to take care of. If you take care of that, automatically, the remedy starts working. I hope you understand, everybody. I hope, Anushka, you got that. Internal and external piles, what medicines are? See, Dr. Saab, internal external piles, homeopathy has a very interesting remedy. Hemorrhoids, esculus, calcarea flow, ratina, aloe, sulfur, nux vomica, China, lot of remedies. Please add few symptoms more, so that I'll be able to give you remedies better. The patient is hearing V sound, please say medicine. Husna Amin. See, again I tell you, see, whenever there is, noises in the ear, tinnitus problem is there. So these are the cases where, what will I tell you? Again, very difficult to understand, difficult to treat, but then you have to treat these cases. Now, tinnitus, I have seen, please write down this, whenever the calmness of the life is lost, you can get a lot of sounds in the ear. The patient wants calmness. So you can think about lot of remedies. Which remedies would I tell you? and I will first tell you something of with my experience, okay? Then I will tell you a lot of remedies. My experience for this type of complaint, Dr. Husna, about the first 10 remedies. Think about phosphoric acid, think about China, think about opium, think about arsenic, think about graphitis, lycopodium, causticum, aurum metallicum, sepia. These are the remedies which I can. And then you can think about some other remedies like Viratrum, Thuja, Staphysagraria, Stannum metallicum, Silicia, Spigelia, a lot of remedies. So first understand where is the calmness lost, and then you can proceed in the case. Swelling after getting fresh pain, swelling after, okay. So we have the classical symptom, hemorrhoids. Now, if you open the chapter of hemorrhoids and if you see there is after bathing, now again one thing you have to understand, bathing with hot water, bathing with cold water, this also is a very very important symptom in a mater medica. You can think about few remedies, please write down: lachesis, muriatic acid, nux vomica, sulfur. Okay, I hope you can understand. I hope I am not very fast, Dr. Barbel. I hope I am not very fast. You can understand what I want to convey, because if there are a lot of questions, I want to finish and leave no questions for the next YouTube live, because the link is lost. So if you can't understand, please go home and again watch this YouTube live, so that it's easy for you to understand. You can add one more remedy in that, Dr. Rai, that is Paeonia. Paeonia. Paeonia, again a very very important remedy, Paeonia officinalis. There is swelling and there is congestion lot, okay? Yes, you are fast in the rec. Okay, depending on a lot of questions, I become fast, but I have developed a habit of speaking slow, because all Germans, all European crowd want it very slowly. So of course, because of a lot of questions, I want to finish off the questions in the one shot only. So let us go forward. That interesting result for gradatory fatty liver. I told you something how to enter a case of fatty liver. I hope everybody understood, because I was very fast. I hope you understand how to enter the case of fatty liver. It is possible sometimes that you cannot interpret mind symptoms, because there are different schools of homeopathy. Different schools understand a rubric differently. Waking aggravation means in the morning you wake aggravation, or you have waked up late in life aggravation, that also you can take. So one rubric has different meanings. So that's why it becomes very very difficult. Okay, so let us go forward. Sir, BP high 150/95, please suggest suitable medicine. BP high would be, Dr. Faisal, would be Ralphia, Crataegus, Aconite, Glunine. These are the remedies you can think. Ralphia Badr works very well, but it will give a breathing time for the constitutional medicine to work. Rheumatoid arthritis, Dr. Faisal, sorry, I cannot tell you the protocol. I have never given in protocol, because I prescribe one dose and then wait for the results. Just now I cured a case of arthritis with a simple remedy, pulsatilla. The patient is absolutely fine now. Osteoarthritis, both knees, doctor suggests transplant, very much pain on walking, no swelling and edema, please suggest. See, acid floor worked 50%, very nice. You can give acid floor in LM potency and see how does it work, हो ना. सर, मुझे यूरिन इन्फेक्शन हुआ था, पेशाब में जलन और इचिंग, इरिटेशन, जलन को ठीक. Whenever there is itching, burning in the urination, think about Cantharis, Uva ursi, Lycopodium, Berberis vulgaris. Right cervical pain, sir, account, okay, sir. Right cervical pain, Semesifuga, Lycopodium, Macphos, Rustox. Dr. Uppal Paul, good afternoon. Okay, if you just want the remedies, it becomes very easy for me. Remedies come very quickly. But if you put about 2-3 symptoms, then I have to think and repetize mentally and they'll tell you the remedies. So urine burning is, again very very easy. If you say just burning in the urine, there are so many remedies. If you give me some more symptoms, I'll be able to give you better. But okay, Cantharis, Ova ursia, Terebinthina, Lycopodium, Berberis, Cannabis indica, Cannabis sativa are very very interesting remedies which you can think about. Okay, so let us go forward. Yes. I think you all should be fast in asking questions rather than me answering the questions. Thank you. Good words. Thank you so much, Dr. Sumati. So I was just telling you something about the mind rubrics. It is not every time very easy to interpret mind, at least for the young students or immediate doctors, because there can be a lot of difference in interpreting a mind symptom, a simple mind symptom. So if you get the local symptom of what the patient has come for, that also is very important, my dear friends. Don't always rely on that. In fact, local symptom, defining symptom of the patient's local part can also give you the remedy. Okay. Berberis vulgaris, no, I said first Cantharis. Cantharis has the most important symptom of urination and burning. So first Cantharis you must give. Severe pain around the testicle due to epididymis or varicocele. Dr. Faisal, severe pain in the varicocele, epididymis, then few remedies are very very important. That is, first you must think about rhododendron, clematis, hemamelis, arnica, calcarea flower, a lot of remedies depending on the symptom similarity, then you can prescribe, my dear friend. Okay, let us go forward. So I was just telling you about the mind symptoms. So that's why there are so many rubrics in the repertories, and sometimes when I tell you something about mind, you can search the mind rubrics and you say, okay, it is so difficult, I will never be able to get it. I was sim 25 years back, but now I have developed a habit. So now if you are a young homeopath, it is not always important you go to only ask mind symptom. If you can't get it, you can give the generalities or the head symptoms or the stomach symptoms or the urine symptoms or the extremity symptoms. Also, if you get good symptoms, if you get defining symptoms of the patient's local part, then also you can prescribe the medicine. Just make a note in your Mater Medica. Okay. So good. Yeah, Dr. Raha, nice to meet you. Salams. And so nice that you are there after a long gap of few months, I think. Yeah, nice. Yeah, so I think whatever I have said is translated very fast. Nice. So that is a difference, because a lot of people shouldn't ask me, sir, what you interpret in mind symptom we are not able to interpret. I tell them the same thing. You just gradually evolve in your practice. Don't get stuck up. Mind is important, body is important. Keep on evolving every day, and you will find that you also get good results in your practice. Hello sir, voice female जैसी रहती है एंड फेस पर हरे में testosterone. Yeah, you can prescribe testosterone, Dr. Khan, but there is one more rubric, effeminate, female type of personalities of male. First remedy pulsatilla, second remedy platina, third remedy silicia, fourth remedy I think calcarea carb, fifth remedy should be I think lycopodium. Testosterone I have used where the patient has male type of voice, male type of personality, hirsutism, male bass voice. Given remedy is not working, then testosterone intercurrent gives fantastic results. Don't use testosterone only to increase the testosterone levels of the male for male infertility. It will not work. It is tautopathy, so don't go for that. Intercurrent I have found very beautiful results, very good results in these type of cases of female problems. Okay. Hello sir, I hope you got it. कैंसरियस भी ले लिया, कैंथरिस ओके. ना सिम्टम देखिए, कैंथरिस लिया, युवा उर्सी लिया, टेरिबिंथिना लिया, पल्सिटेला लिया, लैकोपोडियम लिया, बहुत सारे दवाई है डॉक्टर साहब, लॉट ऑफ मेडिसिन. सी मोर सिम्टम्स. ओके. What is the scope of azoospermia and homeopathy? I just did a webinar on azoospermia where the sperm count was 0. In fact, Dr. Raha and all have seen that case, and the sperm count increased, and now the patient have conceived and they are very happy. Depend on case to case. Every case I am not able to cure of azoospermia, but good results of azoospermia. Uterine bleeding in an 80-year-old lady mixed with pulsatilla. She says it comes after a few days and just drops little blood. First of all, uterine bleeding, old age, that is very, very important, so whenever there's uterine bleeding of old age, it is very important to understand what is the cause and what is the pathology. Sometimes, just because the uterus are very fragile, the muscles are fragile, it flows off. If you see in the repertory, in the Mater Medica, phosphorus is there, sickle core is there, Michela repens is there, and Waxmus, and you can think of Sabina also. Okay, so it is already half an hour up. Thank you everyone. Thank you for joining, and I hope you enjoyed as much as I enjoy sharing my knowledge with you. Thank you. Until next Saturday. Goodbye.